Hi, it's Dr. Paul Durand. I want to talk to you about cleaning your nose after rhinoplasty. So there's really 3 things that I recommend you use during the initial post-op period to really keep the nose clean as things heal. First thing I recommend is hydrogen peroxide. Hydrogen peroxide helps you clean the dry blood and the crustiness on the incisions, both inside and outside the nose, depending on what procedure you're getting. So first thing, hydrogen peroxide, you can get this at any drugstore. So now I'm going to teach you how to do it. So part of the incisions are inside the nostrils, and sometimes we have incisions on the outside, both in the alar rim, depending if we did an alar base resection or narrowing here. And sometimes we have a little incision here in the columella, or the skin between your nostrils. So the first thing I do is with one of the Q-tips, you dip them in the hydrogen peroxide, and you clean the outside of the incisions wherever you've done the incision. And that should bubble a little bit when it comes into contact with dry blood. And that's good because we're breaking that apart and we're basically keeping it clean for things to heal in place. Then I use another Q-tip for the inside of the nose, okay? And you don't have to go too far in, it's just pretty much the cotton part. And you go in, and I have the patient do it themselves because they're gonna be the ones feeling it, and they can really take advantage of this and really go at it well. You're gonna have, in the first few days, or the first 5 days, you're gonna have Doyle splints, or these little silicone sheets inside the nose and silicone tubes that won't let you go more than 1 centimeter or less inside the nose with the Q-tips. And it's okay if you touch that, there's nothing you're gonna hurt there. So most often than that, I have patients be a little worried about that, but I tell them you should be more worried if you're unable to clean it well. So you really wanna make sure that everything's clean during that first, especially that first 7 days. So the second part is where we're gonna use a mupirocin ointment. This is an antibacterial ointment or an antibiotic ointment. I like using mupirocin, and this is something that I prescribe to all my patients. You pick it up in the pharmacy, and I have the patients use this at least twice a day, ideally 3 times a day with each cleaning. So after you're done with the cleaning, use a Q-tip, you dry that area, and then with another Q-tip, you apply this. And you apply it both on the inside of the nose, so inside this way, okay, where the incisions are. And I use a second Q-tip to apply it to the different areas if there's incisions outside the nose or in the columella here. And if you overdo it, that's okay. I'd rather you overdo it than underdo it. So step number 3 is really one that I want you to do, not just during the time of the cleaning, so 3 times a day during that first week, but also throughout the day. And I like people doing it almost every hour. This is the kind of thing you can't overdo, in my opinion, because I don't want you blowing your nose while you're recovering, because that can shoot bacteria up through the incisions. I like you using any saline nasal spray. So it's just salt water. You can buy this at CVS, Target, anywhere. And it's really cheap, and it'll act basically to moisturize the area and really keep that area clean. There's no right way to do it. In general, you uncap it and you put your head back a little bit and you squeeze up. And you want to do it yourself because you want to keep one in your purse, keep one in your car. This is something that during the first few months after surgery, I recommend you use it a lot, particularly in places where there's very dry air, indoors, due to AC and heat and all that. We want to make sure you keep everything really moist in the inside. So this is how you clean your nose after rhinoplasty surgery. Ideally, you want to do this 3 times a day for the first week or so while you have the splints in and outside the nose. After that, usually about a couple times a day for that first month. And then after that, you can only do the saline spray as much as needed. Thank you for watching, and see you in the next video.